Dr. Oz reveals the 5 hidden signs you have a gluten allergy.
I'm here to tell you that it's very real.
The symptoms attack and won't go away.
Patients are coming with many different complaints.
Skin rash, joint pain, weight gain, stomach pain.
And this is a huge tip-off that you have a gluten sensitivity.
How to take control of your body and get your life back.
We're going to reveal the major signs of a gluten sensitivity.
Coming up next on Dr. Oz.
Until very recently, if you thought you had a gluten sensitivity, your doctor would have told you there's no such thing. But I'm here to tell you that it's very real. And I've got the 5 hidden warning signs of gluten sensitivity that every woman needs to know. Joining me is Dr. Amy Myers, who's on the cutting edge of recognizing and treating patients for gluten sensitivity. So what's the one thing you're seeing across the board with all of these folks who have gluten sensitivity come see you?
Well, patients are coming with many different complaints, and they just can't pinpoint the cause. Frequently, they've seen other doctors, they've seen specialists prior to coming to me, and because those doctors don't really believe in gluten sensitivity, they're not getting diagnosed.
Spend a lot of time getting patted on the head saying it's not real. So I'm going to cover these quickly. We're going to reveal the major signs of a gluten sensitivity, the symptoms that you may live with every day, but now you can blame on something else because it's not your fault. The first hidden sign of gluten sensitivity is weight gain. And I'm going to say, before we even get to this demonstration, because I love this little thing we have about to show everybody, you say it's not just about eating gluten that's making us heavy. It's beyond the actual calories.
Absolutely. So when you have a gluten sensitivity, it's really getting your hormones out of whack, and that then leads to inflammation and swelling.
All right, so now we all know that. Let me show you Dr. Myers and others, experts in the field, what they're saying. That when you're gluten sensitive, if you eat gluten, your immune system's attacking the gluten as if it's a foreign invader. Veronica,
hi.
Thank you for playing with us today.
Absolutely.
So with Dr. Myers' help, we're going to demonstrate to everybody what we're talking about here. So you've been attacked by a, and your body senses that because you've eaten things with gluten in them. So when that occurs, what ends up happening? You've got a frenzy inside your body. Hormones are going crazy. And those hormones are leading to chronic inflammation. And in addition to chronic inflammation, you get fluid retention. And it begins to get a little uncomfortable. You hold on to fat that you didn't think you needed to hold on to, that you should have burned off. And every time you have a cereal, or a piece of bread, or some pasta, or even soy sauce, it starts to get a little heavy in there, doesn't it?
Yes, it does.
Because all these things have gluten in them. And even if you go on a diet, and here's the part that's most frustrating for so many women, even if you go on a diet, if there's gluten in there, you don't lose weight, you still have those symptoms, and you feel a lot heavier. Is that uncomfortable?
A little bit, yes.
Yeah. Is that how you sometimes feel?
Yes.
This is how a lot of you feel. Am I getting this right? Yes, you're all nodding your head. I get it. And it's frustrating because you're doing all the right things, but you don't want to have all this inflammation messing up your worldview. So thank you for marrying that. Is it really that heavy? Should I help you get this off?
Yes, please.
Thank you.
Okay. So I want to take these off. I want to get rid of these for good so you can go back to the body hiding inside that cage you otherwise feel that you're living in. Get rid of those things. All right, thank you very much.
Thank you.
All right, the second sign of a gluten sensitivity is irregular bowels. So let's talk about what this means, Dr. Meyer. Describe what typically happens to folks if they're having a gluten issue.
Yeah, so I call it the confused gut. One day you might be having digestive issues such as diarrhea or constipation or bloating or gas, or you might even be regular. So your gut's really kind of confused here. It doesn't know what's going on.
So your monthly calendar, if you do chart what's coming out of your bottom, which you probably should if you got concerned about this, it looks like this. It's all over the place. And you can't make sense of it. And as a physician, we can't make sense of it either because they don't seem to fit together. And this is a huge tip-off that you have a gluten sensitivity. And why does it happen? Why does gluten wreak such havoc with our gut?
Well, the gluten, if you have a sensitivity, can cause irritation of the lining of your gut. And then that leads to these symptoms and ultimately a diagnosis of irritable bowel syndrome.
Yeah. So we walk around with diagnoses about the symptoms, but we don't understand the root cause, which is why I value having doctors who have expertise in this area on the show. The third sign of a gluten sensitivity is joint pain. Thank you for joining us.
No problem.
You'll help us demonstrate this in a second. Why is this common among your patients?
Well, in fact, a lot of people are coming in with joint pain. And when I hear that, the first thing I think of, particularly if it's joint pain in your elbows, your hands, your knees, is gluten sensitivity.
So, Arlinda, thank you for joining us.
Of course.
How are your joints feeling today?
A little tight, stiff. After sitting for long periods of time, I get tightness and stiffness in my elbows and my knees. I don't know where it's coming from.
A lot of us have those symptoms. We're not sure why they're happening. So gluten actually can cause painful inflammation inside the body, throughout the body, in all the joints, and muscles as well. Besides that swelling that we spoke about earlier, you'll get the stiffness. So if you can, put these gloves on you.
Sure.
And tell me how they feel. You notice they're a little rigid, folks. This is exactly what sometimes your body feels like. Is that pretty close? What if sometimes?
Yes, yes.
All right, so go ahead, if you don't mind. Pick up those ping pong balls and hand them over to Dr. Myers over there. You can go faster than that, can't you?
Are you kidding me? You can't lift these things.
It's hard to do, isn't it? We better help you. Oh, come. Just do one. One.
Right.
And you celebrate with one ping pong ball.
Wow.
What is that like? Describe what that feels like to use those gloves.
Well, tight, heavy. I mean, I can't lift them. I can't bend my hands. So.
And it's frustrating.
Yes, it's very frustrating. It's very frustrating.
And then you resort to pain medications and things you think will deal with the symptoms of this. But this is how patients describe themselves when they come in with a gluten sensitivity. But of course, the joints have been attacked, but they don't know why. So we start prescribing medications without looking at why it might be happening. Thank you very much.
Thank you.
All right. The fourth sign of a gluten sensitivity is a skin rash. And Dr. Myers says there's a new gluten skin rash popping up, a find that I'd never heard of before today. And I like having doctors on who really treat patients because you see this stuff. It's not in the textbook. So what are you seeing in your practice?
Absolutely. Very common that I see something called chicken skin or keratosis pilaris. And when you eat gluten and you have a gluten sensitivity, it can damage your gut, leading to a difficult time absorbing essential fatty acids and fatty vitamins such as vitamin A and vitamin D. That then in your body manifests as this chicken skin.
Yeah, so look for those little bumps that you saw in that picture before, because that's one of the common things that Dr. Myers is seeing. The fifth sign of a gluten sensitivity is other food sensitivities they didn't used to have a problem to. So why is this happening?
Absolutely. So when somebody comes in complaining of food sensitivities, particularly to like dairy, corn, and soy, I think maybe it's actually a gluten sensitivity. They actually have similar proteins, and it's called cross-reactivity. It's almost like a case of mistaken identity. So you eat this dairy, and your body goes to attack it like it's gluten.
Right. Let me show you what Dr. Myers is talking about. So gluten has a lot of proteins in it that are very similar. Think of them as sister proteins, notably with corn and with dairy. But your body, especially if it's sensitive to gluten, can't tell them apart and sees all these different sisters, because you can all tell sisters apart, right? Sisters look different from each other. So if I had sister proteins in wheat and corn and milk, you should be able to identify them. But the body can't anymore. It can't differentiate them. Go ahead and turn around, sisters. And in fact, it sees them as triplets, which is exactly what we're talking about. You get a big inflammatory response and cross reactions. You get messed up with corn and dairy that normally wouldn't bother you. So if I got this right, and you're seeing this all the time, and again, people in my specialty, heart surgery and frankly general medicine, aren't getting this. How does the average viewer find someone like you?
Absolutely. So I recommend you look for a functional medicine physician in your area. We really listen to your symptoms and seek to find the root cause of your illness rather than just treating individual symptoms with pills.
And let's say someone has followed along, and of these 5 hidden symptoms, they've identified a few in themselves. So they suspect that they're gluten sensitive. What should they do?
My first recommendation is always to do an elimination diet. Take gluten out of your diet for about 2 weeks, add it back in, see how you feel.
So you got a game plan now. Diagnose yourselves if you think you got this problem and take advantage of Dr. Myers' advice. Thank you very much.
Thank you.
If you have a concern about gluten sensitivity, go to DrOz.com. We have an elimination diet one sheet that you can print out and a 7-day gluten-free meal plan. They are wonderful and they'll help you. We'll be right back.